specialists, females, males. There are just so many different ways that people run their offices and have different type of philosophies with dentistry. I would definitely find a mentor. So right now I have 2 mentors I can definitely call on, but I've utilized them since before even going to dental school. We've really connected, and they always are, telling me, make sure you just give us a call and ask us any questions. Definitely study. I'm sure everyone is so busy, and either you're in high school or in college, and studying is such a huge thing, and I know you're probably tired of studying, but make sure you are trying to get A's and B's. I had a oral surgeon when I was in high school tell me, this is what they told me. So he's like, I'm going to, tell you. So now I'm going to tell everyone. He always said the ABCs of, school. A's will open doors, B's will keep doors open, and C means C for closing doors. So if you do get a C, it's not the end of the world. It just means, you probably should retake that class. Never give up on your dreams. Even if you get a C, it's not, like I said, it's not the end of the world. Plenty of us have gotten, I can't even tell you how many times I remember, I totally failed an exam in dental school. So, everyone does it. We are not perfect. If you put your mind to it, anything is possible. There were a lot of, doubt, maybe my first and second year of college. I just was in the thick of probably, I think it was physics that really took a toll on me. Organic chemistry is a huge one too, I know. But if you just push through it, just think of it as you're only in that class for so many weeks a semester, and if you just study, put your mind to it, you can definitely do it. Always have a good work-life balance. That is definitely something that I am, still striving for even now as a professional, but even in college, make sure that you are doing things outside of school, that you're balancing taking all those exams. Make sure that you're, running or working out or doing yoga is your thing. Mine was Zumba. So now it's running. I feel like I always just change, but just staying active, and I even had friends that weren't pretty professionals, so it was nice to just be able to text them and say, hey, listen, let's go to the movies or do something, just doing something outside of school. Sometimes you deserve to take a break. So now we're on to what is general dentistry. So that's what I do. I do general dentistry. It is definitely treating patients oral, but you're also looking at the patient's overall health as well. There are a lot of different, medical disorders that you can see in the mouth, and you might be able to diagnose before a patient is actually formally diagnosed in a general physician's office. It is amazing, periodontal disease has been linked to diabetes. We take blood pressure. So if you see that a blood pressure is abnormal, just recommending them to see their general physician. You might actually be able to help the patient with their overall health. Oral health that we treat is typically, cavities, pathology, pain, any of their teeth concerns, aesthetics, any type of teeth or jaw alignment. Like for me, my braces, my teeth and jaw alignment, cracked teeth, and we are always doing an oral cancer screening while we do exams. So what's so wonderful about general dentistry is how amazing you get to see families grow. You get to see, I see kids as early as 1 year old and treating their parents, their grandparents. It's just so much fun because sometimes they typically schedule their appointment the same day and they don't even know it. So they walk out and a family member is sitting in the waiting room, and it's just, I don't know, it's just so much fun. and like I said, patients become family. You get to know them so well, and you get to see them definitely every 6 months, but you might see them more too. So what's a typical day in my office is we do 7:45, we do a morning huddle. We do an 8 a.m. start time, and then sometimes we go 8 to noon, or we just work straight through lunch. Usually if we work through lunch, we're doing like an 8 to 2 schedule, or, an 8 to 3. If we do have a lunch break, we do work from 1 to 5. This day can include lots of different things. It can be a cleaning, like I said, the oral cancer screening with an exam, fillings, crowns, diagnosing any type of pathology, referring to specialists, or coordinating with their general physicians or their cardiologist, or dermatologist. Sometimes we see sometimes an abnormal skin lesion around the lips or even on the lips. And so we have to coordinate with a dermatologist. One of my favorite classes in dental school was actually dermatology. Like I said, getting to know patients. Sometimes it is, we have emergencies too. So patients coming in with pain. And we're always having fun. We are recent to TikTok. And so doing TikToks and things like that, we like to always have fun. With the whole entire staff, or even, we sometimes will celebrate even a patient's birthday. They came in on their birthday, which is awesome and always fun. All right. What are patients' typical chief complaints? So we always address those when they come in for any type of appointment. A patient will either say, hey, listen, doc, I want you to take a look at this tooth. Sometimes it is their jaw is hurting. They'll have what's called like a TMJ flare-up. So we typically see that with our patients who either grind their teeth or clench at night, or sometimes they'll do it even during the day if they have a very stressful job. Cracked tooth syndrome has been more common, especially with that clenching and grinding. Sensitive teeth. And sometimes patients want the shade of their teeth to be a little bit whiter. So we address any type of whitening. What type of procedures do general dentists perform? So we typically perform fillings, crowns, simple extractions. Sometimes general dentists can go to a little bit more surgical extractions. Invisalign, which is like braces, just with trays instead. Root canals, which is considered endodontics. Whitening, veneers, and sometimes even general dentists with training, they are placing implants. We do place, I personally place implant crowns, so I restore the implant. All right, so what should I be doing to prepare for dental school? So I get this question asked a lot, especially more recently. I have some awesome shadowers coming through my office that are, in college, and they're always asking me, like, what can I do? So these are moving forward, these next few slides are kind of more of my portrayal of the application cycle and what had worked for me. So obviously definitely focusing on school. Again, doing activities outside of the classroom. So whether that's if you're involved in the pre-professional study club or a pre-dental study club or even Spanish club, something, that you're involved in your actual college is great. I'm sure many of us are on lots of different, have lots of different activities, or you're doing them currently. So definitely balancing that. You can always say no too. So sometimes I put too much on my plate, but I find time. So if you feel like you're getting, overstretched with studying for the DAT, being a part of, the clubs and things like that, like make sure that you are focusing on the thing that you need to focus on at that time too. So definitely studying hard for the DAT. That's leading into the next thing. But also doing activities outside of school. It just shows that you're a little bit more well-rounded individual. Volunteering. I was a part of the Women's Golf League at a local club outside of college, and so that was a lot of fun too. Forming your study groups and having great friends. So whether you have a great study group that is pre-dental, or even if they are pre-medical, you guys are all going to the end goal is about the same. You're going to professional school. So having a great group of friends, and it does not mean that you have to be with everyone who's applying to dental school. That group of friends, if you do end up going to dental school together, you guys are so lucky. That just will continue your study group in dental school. Shadowing different dentists. Like I said, there are different approaches to dentistry. Lots of different technology that's in dentistry. So different offices have different updated technology. So I think it's great to kind of see what everyone has. Again, my recommendations for your application cycle: apply early. They always say early bird gets the worm. I applied the first day, which was, I just remember it being a challenge because the internet kept going in and out because so many people were on that website. So, but I did finally, I was able to apply the first day. And I ended up getting, I think, 2 schools. I got their first interview day. And I don't know if that has any correlation, but applying early never hurts. Definitely review the app before you apply. I don't know if they have this or not still, but they had like a sample app online. And so I was able to download it, and I didn't realize that there were word limitations. So that actually played into me preparing for the application, because I had to actually sit down and maybe cut down on my personal statement and things like that. This also is that time probably between you taking the DAT and applying, gaining all your letters of recommendation. Make sure that you, even in your career, make sure you are creating relationships with professors and realizing that these professors may or may not actually write you a letter of recommendation. I actually still talk to one of my letters of recommendation. It was a professor. And so even if you have that relationship in college, I still have it even after dental school, which is amazing. So they really need to know you so that they can really write on a piece of paper a good recommendation, because I really believe that those recommendations, are looked at. So prepare for interviews. I prepared for my interviews by having a professor sit down and ask me a lot of questions, things that I kind of did not realize that they may or may not ask. I also kind of got stumped by a couple of questions, so it made me start thinking of like things that they definitely will ask. There is a dental interview guide on Amazon. That's actually what I use too. I remember giving the book to my mom and having her like ask me the questions. And I remember we were like visiting a beach, and she was just sitting there and asking me them. And I actually think that I wish I would have put myself in more of a like suit to jacket and realized that calming environment that I was in is different. You're in a little bit more button-up type outfit. So, and you're not going to have the wonderful waves in the background. So, definitely stand out. So standing out, for me was I did a human cadaver prosection program, which every interview that I had, and let's think how many I had 4, and I applied to 7. So out of the 4 interviews, 3 of the 4 asked me about my human cadaver prosection program. And the only reason why one of them did not was because it was a group interview. So I stood out in that aspect. I found something that actually benefited me in dental school because you do work on human cadavers. So, finding something that makes you stand out would only benefit you. Focus on your personal statement. So definitely make sure you find time to write that personal statement. Find time to review it. I think I went through 13 reviews, and mind you, I don't recommend that at all. I felt like I changed one word every single time after the fourth or fifth review. But being able to tell your story on a personal statement would also really benefit. It benefited me because they asked me a couple questions in my personal statement because I explained, maybe why I didn't do very well on my first year of undergrad, and that was because I was traveling so much, being a student athlete. And so, definitely being able to kind of even write why you want to go to dental school, will definitely help them, view you as a person, but on paper. Find a hobby that will help with hand-eye coordination. That really goes a long way because we do indirect vision with dentistry, and you're using the mirror a lot. And so just by looking in the mirror, it's opposite of what I don't know how to explain it, but to me it felt like it was opposite of what I was actually doing. So having that hand-eye coordination will not only help you post-dental school, but it'll also help show to the dental school that, you are really focused on, you want to work with your hands. So that is, playing an instrument, knitting or crocheting, or, doing some type of ceramics. And I will say, 2 of the interviews asked me to show them my knitting. So that took me by surprise at the first interview. So I was prepared for the second one, but I didn't think that they would ask me to see my knitting, but luckily I had some photos. So, again, apply early. So, all right. Things to prepare for graduation during dental school. So, once you get to dental school, it is so, you're just surrounded by so much teeth and dentistry all day long, but, dental school, they can only put so much in the curriculum to get it down to 4 years. I mean, it is truly amazing how much they can even get in 4 years. So dental school probably could be up to 6 years if we went through all the business side, the insurance, and things like that. So the things that helped me in dental school, which you can definitely do now even as a pre-dental student, because I find some of the things that they talk about are absolutely amazing. So one of the podcasts that I listen to, or actually I listen to almost all of these, or I've read them too, the books. So Shared Practices, Little Black Dress podcast, and then I follow Dental Nachos. There's so many other ones. There's Dental Clinical Pearls. There's just so many really cool things that, forums that you get to connect with all dentists across the entire U.S., which is absolutely awesome. I have made friends that they did not go to the same dental school as me, and they live in states that are 10 states away from me. Some books that I definitely highly recommend, and again, like I said, you can actually read a couple of these even as a pre-dental student. The Millionaire Next Door, you can follow the White Coat Investor, on Instagram, or they have a podcast or their website. They really do talk about, you kind of handling and balancing your student loans, whether you're going to have those or not. I have them still, and so it is something that you definitely need to consider. Understanding dental insurance, 100%. I would read this book before I would have graduated. I read it 6 months ago, and it was 6 months too late. It actually was 4 years too late since I graduated. I can't believe that, 4 years ago. So another great book is Uncomplicate to Business. Again, if you're wanting to own your own practice, this is a great book to read. Hidden Treasures, Finding the Missing Revenue. Heidi Mount is absolutely amazing. She takes you on kind of behind the scenes of your practice. Books are always ever evolving. So there are a ton of books out there, and I feel like every month I go and look at my Amazon account and I'm like, oh no, I need to go buy, I'm done with the book, I need to go find another one, and sure enough, there's another one. So definitely take advantage of CE while you're in dental school. I can't stress this enough. I wish I would have done it. You do get a student discount, and CE cannot hurt. I mean, the more you can absorb as a sponge, the better you will be as a dentist outside of dental school. One of them is the Breakaway Seminar. And then you definitely need to find out where you're going to live. I was back and forth of whether or not I was going to move back to my hometown, and that kind of delayed my process of finding a job. But I figured it out, I would say like 2 months and maybe even a month before I graduated. Get involved in your dental society where you are planning to live post-dental school. Again, if you get involved before you graduate, it's also another opportunity to find a job. All right, things to do post-dental school. So these are things that you get to look forward to, and that's why I'm kind of discussing them, or just kind of getting you ready for things to also do, because dentistry is just awesome, and there's so much you can do. So, you know, be involved with your dental society. I graduated, and my college friends went to professional schools and also in other states. And then they went to residency in other states again. So, you know, we're not in the same zip code. And then my dental school classmates also went to other states post-graduation. So it took a lot to find some new friends, especially I was so used to just being in a little bubble with, you know, going to school and everything like that. But once you're out of school, I just didn't have that dental, especially the dental community. But I found my society, and I became friends with, you know, they would have been my classmate if we would have went to the same dental school, and they just moved here. So stay connected with your dental school friends. I'm actually going to visit one this weekend. I'm so looking forward to it. A lot of us haven't seen each other because of the pandemic, so it's so much fun to finally be able to do our yearly reunions. We stay connected. I'm sure they're actually probably texting me right now in our huge group chat. Well, I love it. I mean, we bounce ideas off each other, like, hey, what should I do in this scenario? Because sometimes you're going to see patients and you never thought you would ever see something that you never saw before. Here I thought I saw it all, and then someone walked in the door and I have never seen that before. So prepare for ownership or find your forever associateship too, and then always stay up to date with the latest technology. Even now, as a pre-dental student, you can already learn all about technology and start going to conferences. That's only going to benefit you in dental school. But definitely knowing whether or not you want to be an owner will also help you through your dental school pathway. I connected with different faculty at my school because they were owners, and so I really wanted to know, like, you know, different pearls from them. But being a forever associate is also, I mean, it's amazing. I miss some things about my associateship, but there are a lot of rewarding things as an owner as well. I mean, either one is totally okay. Or you can always, you know, join, you can go to a residency, or you can join the Army. I mean, there are so many different avenues with dentistry. It is truly amazing, and I really did not know that until I was in dental school, where they taught us, you know, there are all these other things with dentistry. All right, so I just want to say thank you so much for having me. Please contact me. You can message me on Instagram I'd be more than happy to answer any questions. I'm truly an open book. You know, please just stay focused, but always still have fun outside of studying. And, you know, good luck. You're going to do great. As long as you put your mind to it, you can definitely do it. So, all right.
I just want to thank you again for coming on and giving a very informative and a presentation I really enjoyed. I have a few questions if time permits. Is that okay?
Yeah.
So my first question is regarding, you mentioned having a mentor, and that's unfortunately something I didn't really get to have, but I see like you were discussing how much it benefited you, and could you just like maybe reinstate like specifically in undergrad what your mentor did for you and what you learned and how that helped you get in the field and what advice you learned?
Yeah, so my mentor, I actually just saw 2 weeks ago, which is awesome. We don't live in the same city anymore, but he welcomed me, and he would come up to me at his office and be like, Jillian, you got to get in this room. You got to see this. You're going to help me. You're going to suction. You're going to take the mirror. You're going to look at it, and you're going to tell me what you see, and I'm going to explain to you everything. So it was awesome because it was so hands-on. The other thing that was awesome about it is he really sat down with me, and he always asked me, like, what do you want to do? And then he would give his perspective on, you know, the same scenarios that happened to him. And I mean, any question I had, it was great. And then in dental school, I just remember, you know, going to him. I still went to him. I was his patient as well. I was still going to him as a patient, and, you know, he would always ask me, like, how are you doing? And I would look at him and I'd be like, do you still do gold crowns? And I mean, just asking him questions that are like, you know, in clinical, I was struggling with one of the injections, which you will learn which one it is, I'm sure, soon. And I was like, what, you know, do you have any techniques or any advice? And so he would like sit down with me, and he would show me like on a model. I wish I had a model with me. I have one at my office, of course. It's a dentiform is what they're called. And he would take, you know, he wouldn't have anything, any of the injections like loaded, but he would take the syringe, and he would point to me and angle things and say, this is what I would do. You know, 50% of my classmates, their parents were dentists. So, which is totally shocking to me. So I felt like I kind of was already, you know, I didn't have that, like, pick up the phone or, like, text at, like, 11 at night freaking out about my denture melting, which is, again, that you'll understand that comment later. But I wish, you know, I could have done that. He totally would have been totally okay with it. But, you know, now being an owner, I get to ask him ownership questions, and I actually saw him at a CE event about ownership, and so even now I still talk to him, and I bounce ideas off of him and like what has helped. He's been in practice probably now for over 20 years, so I truly, you know, definitely would say find a mentor. Now I found a mentor. I associated at his office before owning, and he would sit down with me, and he would show me his burr block. Those are the, you know, the little drill bits that go in our drills. And he would say, this one is the one I like for this. This is what I like for that. And again, in dental school, they only gave us at least, you know, a handful of burrs to try out. And so he really opened my eyes to all sorts of, you know, newer technology and things that really just make, you know, the appointment for the patient a little bit faster. So.
Oh, sorry, I didn't realize I was muted. I really appreciate you sharing that, and I feel like other students could like look to other dentists, because for me, when I shadowed like my second dentist, I spent a lot of time with him, and he wasn't as like as kind, or maybe as like maybe not as welcoming into like the notion of learning. So I think you really highlighted that level of importance of mentorship. The second question I have is, you mentioned starting a practice, and almost every dentist I talk to talks about like the business side, and how like getting out of dental school, they didn't realize, or maybe they didn't have like the clearest idea of how much business it is, and starting a practice as yourself, like in your, you said in your second year after you got out of dental school, or you're 2 years into your practice?
Yeah, so it was my second year out of dental school. I became an owner, and now I'm 2 years into ownership. So
wow, that's also very impressive.
No, thanks. Yeah. Well, so it kind of was a spur of the moment situation. As I'm sure you can timeline that was in the middle of COVID, and it was a month post total shutdown. So I, had just, I knew that things were going to happen, and I didn't realize how expensive the shutdown was going to be. But I was always on the lookout for, different, to buy a book of business to really grow my associateship opportunity. Well, I had always been still on this chain, like an email thread about different practices that were going up for sale and things like that. And so I always am reading my emails, which, by the way, you should totally read your emails. I missed a totally important email this morning, and that's totally on me. So sorry, my accountant, it's tax season and I feel awful. But anyways, I read my email at lunch. I remember I was at work, and I was like, wow, this opportunity sounds great. It's literally around the corner from where I live. It's a practice for sale. Maybe I could look into it and see about buying the book of business to grow my associateship. Well, lo and behold, he was not selling the book of business. And we started talking, and then in the middle of the shutdown, I started to realize that patients are going to be very nervous to come back from the shutdown, with the different bacteria, viruses in the air, and things like that. And I was like, I wonder if I'm going to lose my associateship as a dentist because I'm newer. So we kept talking, and then I started to kind of see signs that, I probably may or may not have a job after the shutdown. So I ended up just kind of on total dreaming land that I was in, which, by the way, you have to be a dreamer if you are a business owner, because you have to dream what your office is going to look like. And so I ended up buying the practice, and he is great. I still talk with my previous boss, and like I said, I still consider him a mentor because I know I can ask him any questions, even now as an owner. But yeah, there is a lot of business behind it, and I did take an extra in my fourth year of dental school, which, by the way, this is totally crazy. So, please don't think that this is normal to do this. I decided to do an online business certification because I knew I wanted to be an owner. It definitely was not geared towards dentistry, so I did learn how to read a profit loss statement and other accounting things that probably did help, but the classes in themselves, I learned that I can't do everything, even as a business owner, as a dentist too. So you have to learn, for instance, marketing is something that I struggle with. I didn't go to school for it, but I have to do it for my office to attract new patients, because I bought a practice that the dentist retired, and in the last couple of years, he was going towards retirement. So I would like to do the opposite. So I want to go up in days. So I learned very fast that marketing is not my thing. And so you kind of have to be able to realize your limitations, not only as a practice owner, but as a dentist. And so I have to send my marketing. Someone else has to do that. So I have hired someone else. Currently, please do not look at my website right now. It is one that I created, and I worked long hours on it, but it is going to be updated here probably in the next month. So someone is working on it behind the scenes. But I definitely would take away from that if you want to be a business owner, there are so many rewarding things about being an owner. One is you get to pick your own equipment. So I get to ask myself, hey boss, can I order this, and this type of burr? Or, I have certain things in my office that I didn't have at my other associateships that I really wanted, or I saw at like a dental conference, like a saddle chair. I am obsessed with my saddle chair. It has helped me tremendously with my back. So, there are just different things that as an owner, you have to make lots of different. I think the hardest part of being an owner is making harder decisions. Like some of them are very easy, like what color bib are we going to buy this month? And I'm like, we're getting pink because everything currently, our gloves and our masks are pink and our jackets, so we're doing pink. So, that's like an easy one, but whether or not to switch our texting services to help provide benefit for our patients, that's harder because then we have to go through a transition of retraining the entire staff. So I think just realizing that you have to be decisive as a business owner. If you're decisive now, then you already you're going to be great. So, yeah.
I really appreciated hearing that and like the benefits that you encountered of having ownership. And then like the last question I have is honestly a question that I'm a little curious about. Is I'm actually in the process of writing my own personal statement, and when I'm reading a lot of other experiences and a lot of other essays, they mention like a unique experience they had, or maybe some vital thing in their childhood. For me, I don't have the same experience. Like I don't have like a single point, but for me, the thing that I'm inspired by very early on is the merger of art and health and dentistry, especially. Mm-hmm. I feel like other professions do this too, but dentistry is very unique and almost like, and the way you're understanding it's like it's very complete. So do you have any advice for writing personal statements like that in that regard?
Yeah. So as myself, I don't know if you'll be able to see this, but I don't know if anyone else will. But I love calligraphy, so that's my kind of art. Right now, I took that up in high school too. But doing art and dentistry, you have to actually be able to see different colors too, because you're doing aesthetics, or especially if you're working on the front teeth. So, I mean, people go even in depth in the sense that, you can even be your own lab person. You can create a tooth out of ceramic by painting on the layers to make the color shade perfect. So, tying in the art and everything like that, and expressing, maybe I gave you some ideas with that scenario, but seeing different colors and, I'm trying to think what else that would be a good thing to talk about. My biggest thing was I talked about my trauma with cheerleading, and I sat in the dental chair a lot. So I don't know if you have had an experience maybe that dealt with more of the art side of dentistry, or an art experience that may, you can correlate with dentistry.
Really thank you for the advice and the guidance. That's all the questions I have. And I really want to thank you again for coming up on here and speaking. Your presentation was very interesting, and we always appreciate dentists sharing their experience.
Thank you so much.